Hello, good afternoon, everyone. Uh, Today I'm going to discuss with you maxillary and mandibular anatomical landmarks. When we talk about prosthodontics, the subject prosthodontics, it starts basically with analyzing what are the structures which are present in your mouth. In order to understand those structures, we need to have a detailed analysis of the anatomical landmarks which are present in the mouth. Once you are aware with the anatomical landmarks which are present in your mouth, you can better understand and record those structures. So this is a very small effort on part of me in order to make these anatomical landmarks little bit easier for you. Starting with the maxillary anatomical landmark, if we see in the maxillary anatomical landmark, we can see the alveolar ridge. This is the maxilla. This is edentulous maxilla. Edentulous means it is not having any teeth. The patient is not having any teeth in his or her mouth. If the patient is not having any teeth in his or her mouth, that patient is known as edentulous patient. This is the alveolar ridge of the edentulous patient. This is being shown by the arrow. This is the labial frenum. This structure, which is coinciding with the midline, this red line which is being marked here, this is frenum. Frenum is basically a tissue fold. It is a tissue fold and it is present on the labial side, so it is your labial frenum. These are maxillary edentulous anatomical landmarks. You can see the word edentulous. That means there is no teeth which is present in the patient's mouth. This is completely alveolar ridge which is present. Now the second thing which you can see with this triangular part is your buccal frenum. This structure which is being marked here, this structure is your buccal frenum. If you will put your tongue on the side of your cheek, you can feel the buccal frenum. If you will put your tongue in the near your nose, near the upper lip, you can feel the labial frenum. Then is the labial vestibule and the buccal vestibule. These are very important things to be understood, because once you will understand the vestibule, you will understand how you have to do many procedures. So this area, you can see the depth till where your tongue can go. This whole area, which is extending from one buccal frenum till the other buccal frenum, is your labial vestibule. This complete part is your labial vestibule. This is your alveolar ridge. This part is your labial vestibule. And this part going from the buccal frenum till posterior side is your buccal vestibule. This part is your buccal vestibule. Then we can talk about the hamular notch. If we see the hamular notch, we can see this diagram. This is the diagram of the maxilla showing the edentulous ridge. This part is your maxillary tuberosity. This part is your maxillary tuberosity. Posterior to this depression, the depression what you can feel, this is your hamular notch. This is basically this part. If you can see, this is basically the part. This is the pterygoid hamulus. This is your teeth. Once the teeth are present, now the patient is edentulous, so patient is not having any teeth in his or her mouth. This is the maxillary tuberosity, and behind maxillary tuberosity is your pterygoid hamulus. So this part is your hamular notch, which is after the maxillary tuberosity. This is the buccal frenum which you can see. This is the buccal vestibule part which you can see, and this part is extending till here, and this is your hamular notch. This part is your hamular notch. These structures are very important to be understood, because if you will understand these structures, then only you can record these structures in the impression. Then is the vibrating line. Vibrating line is going from one hamular notch. This is one hamular notch till the other hamular notch. Here will be your vibrating line. Vibrating line is something which is going from one hamular notch to the other hamular notch. It is 2 mm away from the fovea palatini. Now, if we see fovea palatini, here are two small dots. These two small dots, they are basically the orifices of the minor salivary gland ducts. And behind these, 2 mm behind these, approximately 2 mm behind these, you can have the vibrating line. Vibrating line is basically a line of demarcation between your hard palate and between your soft palate. This is your hard palate, which is not movable, and posteriorly will be your soft palate. So a demarcation between these two is your vibrating line, and it is extending from one hamular notch till the other hamular notch. It is also known as the butterfly line, and in between the vibrating line is your posterior palatal seal. Please students be clear about this posterior palatal seal. It is going posteriorly. First of all, don't get confused. This is a structure which is present in maxilla. This is a structure which is present in maxilla. Posteriorly means it is present at the back. It is not present anteriorly. And palate, this complete part is palate. So this structure is forming a seal. It is forming a seal posteriorly. It is known as posterior palatal seal. It is basically a soft tissue which is present between hard palate and soft palate. The soft tissue which is present between hard palate and soft palate. It is also known as the butterfly line. Also known as the butterfly line. This is your maxillary edentulous ridge. Completely edentulous. See the word edentulous. This is your labial vestibule. This you can see. This is your alveolar ridge. This is your labial vestibule. This is your buccal vestibule. And this complete what you can see, this line, this area complete what you can see, this is your posterior palatal seal. This complete line, now you can see the line is being marked. This is the red line, and this is extending from one hamular notch, and it is going till the another hamular notch. This is your posterior vibrating line, and this is your anterior vibrating line. So in between this posterior and anterior vibrating line is your posterior palatal seal, posteriorly palatal seal. That is why, because it is a shape of a cupid bow, Dhanush. It is a shape of a cupid bow. That is why it is known as cupid bow shaped. This is the cupid bow. You can see a small amount of dip here, and this region, this is your posterior palatal seal, which is the most important anatomical landmark when it comes to maxilla. And this structure has to be recorded very properly in order to have the retention of your maxillary complete denture. This is the posterior vibrating line, and this is your anterior vibrating line. That is why it is also known as the butterfly line. It is also known as the butterfly line. We are discussing the basic anatomical structures of maxilla in order to have a very brief view about what these structures are. So we talked about the vibrating line, we talked about the butterfly line, we talked about the posterior palatal seal. Till now we have discussed about the alveolar ridge, we have discussed about the labial frenum, we have discussed about the buccal frenum, we have discussed about the labial vestibule, we have discussed about the buccal vestibule, we have discussed about the hamular notch, we have discussed about the posterior palatal seal. Is marking the area of the posterior palatal seal. This is butterfly shaped structure. This is a cupid bow shaped structure which you can see posteriorly. So if you start with the proceedings, first you have to understand that a patient who comes to you and the patient is not having any teeth in his or her mouth, that patient is an edentulous patient. Before making the impression of the patient, you have to see all these anatomical structures in the patient's mouth. You have to see the alveolar ridge. You have to see that the alveolar ridge is smooth. It is not having any bony projections. It is not having any bony projections. It is clear. Fine. Then is the coronoid notch. This is the impression which you can see. This is the impression which you can see. This is the labial frenum which is being recorded in the impression. This is the buccal frenum which is recorded in the impression. Please be clear, you will see the vestibule in the patient's mouth, but on the impression you will have borders. This is the labial border, which is being recorded when the material flows into the vestibule. When the material flows into the labial vestibule, the labial border is formed. This is the labial frenum. This is the buccal frenum. This part is your hamular notch. This part is your hamular notch. This part. And from one hamular notch till the another hamular notch is your posterior palatal seal area. Here will be somehow at the back side. This part is your hamular notch. And here is your this part, this part which he is marking, which is being marked, they here when you close your mouth, this part, the coronoid part of the mandible, it comes in contact with this part. That is why it is known as the distobuccal area of the impression. Distobuccal, it is present on the buccal side and it is present at the back. So this is the distobuccal area of the maxillary denture, very important area. If this area is not recorded properly, once the patient will wide open the mouth or move the mandible to right and left, your denture is going to fall. So this is your coronoid notch. This area is your coronoid notch. Here the coronoid process comes in contact. Then is the pterygomandibular raphe. Pterygomandibular raphe. It connects, this is your pterygomandibular raphe. If you can see, it connects the buccinator muscle and the superior constrictor muscle. Pterygomandibular raphe. If you can see from the name, it is going from the pterygoid hamulus and it is getting inserted in the mandible. And it is a fibrous band, so that is why it is known as the raphe. It is a fibrous band, so it is known as the raphe. It is going from the pterygoid hamulus and it is getting inserted into the mandible part. It is joining the superior constrictor, which is the muscle of the pharynx, and the buccinator muscle. This is the buccinator muscle. This is the superior constrictor muscle of the pharynx, and it is being joined. This is the coronoid notch which is being shown to you. This is the distobuccal area of the impression. This is the impression and the distobuccal area. This is the pterygomandibular raphe that we have discussed. It is coming from the pterygoid hamulus and getting inserted into the mandible, this part. This is your pterygomandibular raphe. Pterygomandibular raphe. This coronoid notch is very important. It is very important anatomical structure. So, in brief, I will revise all the structures which we have discussed till now. In a summary form, I'll revise it. Starting with the structures, we discussed that once the patient approaches to you, if the patient is not having any teeth in his or her mouth, that patient is known as edentulous patient. Once the patient is edentulous, first we will inspect for the alveolar ridge. This is the alveolar ridge. Once we inspect for the alveolar ridge, we see that whether this alveolar ridge is smooth. Any bony projections, any protuberance is not present. That means if you feel it, there should be nothing sharp. Patient should have no pain once you palpate this. If this is fine, you start with the recording of the impressions. This is your labial frenum. This is your buccal frenum. This is a limiting structure which is present in the patient's mouth. Limiting structure means your denture, your impression cannot extend beyond this frenum. This is the vestibule, labial vestibule, and this is the buccal vestibule. Always remember the word vestibule will be associated with the mouth of the patient. You are not going to see the vestibule on the impression. You are only going to see the vestibule in the patient's mouth. Then if I move forward, this is the labial frenum which is being marked. Then if I move forward, it will take little bit time for me to slide with the shares, to slide share it. So if I move forward, then we talked about the posterior palatal seal, which is extending from one hamular notch till the another hamular notch. Posterior palatal seal, which is extending from one hamular notch till the other hamular notch. It is the limiting structure. It is forming a seal. Then we talked about the distobuccal structure, distobuccal portion of the impression. And we talked about the labial and buccal vestibule and the coronoid part and the pterygomaxillary seal area. I hope this brief video will clear little bit of your doubts regarding the anatomical landmarks. Anatomical landmarks, if understood properly, they can help you in better recording of the impressions. Thank you.